Hello everybody, it's me Khalid again, and today I will be talking a little bit about varicose veins. Um, if you remember, I've already told you that arteries are the blood vessels that take blood away from the heart to the rest of the body, and veins are those blood vessels that bring blood back to the heart. So varicose veins is a condition in which the veins are bigger than they should be, they are dilated, and in these pictures you can see that varicose veins can be of different shapes and sizes, and they are most common in the lower limbs or the legs. Therefore, I will be talking about varicose veins in the legs. Now, when we talk about varicose veins, the first thing to understand is how do veins in the legs normally work? What's the normal function? And then we can talk about the abnormal part of things. So, the first thing is there are two types of veins in the leg. The first kind is called the superficial veins, and they are present just below the skin and the ones that we can normally see. The other kind of veins are the deep veins, and they are present between the muscles. Now, think about it. If you're standing up, what takes the blood from your feet back up towards the heart? What actually happens is that the muscles contract and relax. So they're always doing this, getting smaller and bigger. Each time the muscles contract, they squeeze the veins and the blood travels up. Once the blood goes up, what stops it from coming back down again? The reason it doesn't come back down is that the veins have valves in them. And what those valves do is that once the blood goes up, the valves prevent the blood from coming back down. So therefore, there is a one-way traffic of blood going up. And this way, the blood goes up step by step and ultimately reaches the heart. If the valves of the veins are not working properly, then what happens is the muscles contract, blood shoots up, then it drops back down again because the valves are not stopping the blood from coming back down. Therefore, there is increased pooling of blood in the legs. The veins get bigger, dilated, and as a result, people get varicose veins. Now, in this picture, you can see on one side, there's a picture of a vein with normal valves, and it shows how blood can only flow in one direction. Whereas in the other picture, you can see that the valve isn't functioning properly, therefore the blood goes up and then leaks back through the valves again. Generally speaking, varicose veins can be divided into two groups or two types: primary varicose veins and secondary varicose veins. If the varicose vein is due to a problem within the vein itself, like the valve isn't working properly for whatever reason, then that is called primary varicose veins. However, if the varicose vein is due to a problem elsewhere in the body, then that is called secondary varicose vein. Now, what happens is normally when the veins go up from the legs into the pelvis and in the tummy, veins from both the legs join up and make one vein, which then goes up to the heart. Lots of females would have noticed that during pregnancy they have varicose veins, which after delivery of the baby gets better. Sometimes doesn't get better completely, but to quite an extent it improves. Reason for that is because when there is a baby in the womb, it puts pressure on the veins in the tummy, and that causes back pressure in the veins down the legs, and then the veins swell up and cause varicose veins. So if the problem is within the vein itself, it's a primary varicose vein. If it is due to something else, which may be a number of reasons, it's known as secondary varicose veins. Now, if someone has varicose veins of the legs, for whatever reason, primary, secondary, whatever the cause is, what problems can it cause, and what consequences can they have? Well, in the majority of cases, they don't cause any problems. They're just a cosmetic issue, and people don't like them because some say they look ugly. However, certain proportion of people say that they're okay when they wake up in the morning, but as the day progresses and towards the end of the day, they know swelling of the leg with some aches and pains. However, it's very important to know that lots of people have varicose veins and pain in the leg as well, but the pain may not be due to the veins, it may be due to something totally different. So therefore it's important to know if the pain is from the vein or from something else. Some patients complain of increasing itchiness in the legs, and when it goes beyond that stage, you can get skin changes, ulcerations can develop, you can get an infection of the vein called phlebitis, and in certain patients, because the vein is so big and dilated, minimal injury to it can cause a lot of bleeding. Now, I'll give you a brief talk on how varicose veins can be treated. They can be treated conservatively, and certain situations may need interventions as well. The first thing to do in varicose veins is not to stand still for prolonged periods of time, because when you're standing still, blood is continuously pooling down into the leg due to gravity and can aggravate symptoms. Therefore, try not to stand in one place for a long time, and if you do need to stand for whatever reason, move your foot up and down so that the calf muscles continuously contracting and relaxing, and that will push the blood up and help in reducing the pressure within the veins. The second thing to do is that when you're sitting down, try not to sit down with your feet hanging down, because that will promote pooling of blood in the legs due to gravity. So therefore, if you are sitting down, try and keep your foot on a stool or a chair to eliminate gravity, and that will promote more blood flowing back to your heart and help with the symptoms. A lot of people find that wearing stockings help with the symptoms, gets rid of the aching pains and prevents the swelling of the legs. Therefore, that can be used. However, if you do decide to wear stockings, please see your doctor first, because in order to wear stockings, you must have adequate arterial blood going into your foot. Otherwise, stockings can cut the blood supply off completely to your foot, and that can be disastrous. If the symptoms are more severe, causing a problem with the lifestyle, then intervention can be carried out on varicose veins. There are two main kinds of interventions that can be done. The first is endovenous treatment. This is a relatively new technique which has become very popular over the last 10-15 years or so, and all it involves is a local anesthetic injection and insertion of wire into the vein, and the vein can be burned from the inside after giving anesthetic, and that collapses the vein. Therefore, the blood doesn't flow in the vein anymore. It is taken out of the circulation, and therefore the symptoms go away. Not all veins are suitable for endovenous treatment. They've got to be of a certain size and certain shape. And if the veins cannot be treated by endovenous treatment, then traditional surgery can be carried out, in which an operation is done and the vein is actually removed from the body. It's very important to know that before any intervention is carried out on varicose veins, the deep veins should be working adequately, because if the deep veins are blocked and not working, someone's got a DVT, or whatever reason the deep veins are not working properly, then the superficial veins are the only means of getting blood from the feet up towards the heart. And if the superficial veins are taken away, the deep veins are blocked, then obviously there is no channel left for the blood to go from the legs to the heart, and that can result in limb loss. Therefore, deep veins are very, very important when we consider treatment for varicose veins. As well as making sure that the deep veins are okay, it is very important to know whether the varicose veins are primary varicose veins or secondary varicose veins, because if the veins are due to another problem in the body, then there's no point treating the vein, because you've not treated the underlying cause, and patient will not get any benefit from it. So therefore, eliminate the cause for the veins, make sure deep veins are fine, then go to treat the veins. So this was a brief talk on varicose veins, talking about the causes, the symptoms, and a brief summary of the treatment available for it. I've tried to keep the language very simple so that the people who do not know about medicine can understand what I'm saying. If you have liked this video, you think it's been helpful, then please don't forget to subscribe to my channel. Hopefully I'll see you soon with a new video. Thank you very much.